Hello, and welcome to my presentation on dengue fever by Amber White. To begin this presentation, I will talk about general information about the disease. Dengue fever is a viral disease that is transmitted by mosquitoes. Its main vector for the disease is Aedes aegypti, but it can also be carried by the minor vector of a closely related species. Aedes aegypti usually bites during the day, and dengue fever is caused by 4 closely related viruses. These viruses have spread to many parts of the world, including countries like Africa, India, and even parts of the US. Dengue fever is not fatal, but more severe cases can cause death. We will talk about more of these cases later on. The most efficient way to prevent dengue fever is to avoid the bite of the mosquito. Medical importance and history. Mosquitoes are of medical importance because they can transmit many diseases such as dengue fever, yellow fever, West Nile virus, and others. The dengue viruses first originated in monkeys in Africa approximately 100 to 800 years ago. These viruses later infected humans. World War II caused a global distribution of the Aedes mosquitoes spreading the virus. DHF was first documented during the 1950s. The World Health Organization estimates 50 to 100 million infections occur a year. Geographic distribution. This disease is most common in tropical and subtropical regions. Dengue fever can be found in the Indonesian archipelago, northeastern Australia, Southeast Asia, Africa, the Caribbean, and Central and South America. Dengue is endemic to over 100 countries, and travelers to these countries with dengue fever are at high risk for the disease. The map represents places with risk of dengue virus, as shown in orange, and no known risk, as shown in white. Causative agent. The causative agent for dengue fever are 4 closely related dengue viruses. These viruses are known as DENB1, 2, 3, and 4. This virus belongs to family Florividae and genus Florivorus. The viruses are positive single-stranded RNAs. Causes. Dengue fever causes high fever symptoms and 2 of the following: severe headache, severe eye pain, especially behind the eye, joint, muscle, and bone pain, rash, and minor bleeding. Symptoms can occur 4 to 7 days after the bite and can last from a period of 3 to 10 days. Dengue hermaphic fever, or DHF, is also caused by the dengue virus. Symptoms include those as seen in dengue fever, bleeding under the skin, and liver and heart problems. Dengue shock syndrome is also a severe case of DF. This progresses after a person has experienced DHF. Symptoms include shock, coma, and it can possibly be death. Transmission. The main vector of dengue fever is Aedes aegypti mosquito. Only the female mosquito transmits the disease. A female insect acquires the virus from the blood of an infected person. Once the virus enters the mosquito, it affects its midgut and travels to the salivary glands. It takes an 8 to 10 day incubation period before it can be transmitted to another person. There is an increased risk of having DHF or dengue shock syndrome after being infected with dengue fever. A dengue epidemic needs 1. A large number of vector mosquitoes, 2. A large number of immune persons to one of the 4 viruses, and 3. The opportunity of contact between infected and non-infected individuals. Life cycle. The mosquitoes have complete metamorphosis. The stages of the life cycle include eggs, larva, pupa, and adult. The whole life cycle takes an 8 to 10 day period. The adult and egg stages are terrestrial, while larva and pupal stages are aquatic. The pupa stage do not feed. Only larva and adult stages feed. A female adult mosquito needs to feed on blood for reproduction. Diagnosis. A proper diagnosis for the virus includes blood tests. Blood tests provide confirmation that you may have this virus. Other tests may include an antibody titer or PCR for the dengue virus types, a complete blood count, nucleic acid testing, and virus isolation. Treatment. There is no specific treatment for dengue fever, and currently there are no vaccines available. If a person has dengue fever, treatment includes: the affected person should have plenty of rest. They should also drink plenty of fluids to avoid dehydration. Paracetamol and acetaminophen can reduce fever and may also reduce joint pains. A person with dengue fever should not take aspirin, as this can increase the risk of bleeding. Those with more severe cases should seek medical care by those experienced with this disease. Prevention and control. The best way of prevention from dengue fever is to avoid being bitten by the mosquito. Other ways of prevention include removal of containers where mosquitoes can lay her eggs, using insect repellent on skin such as DEET and paraquetan, wearing protective clothing to cover exposed skin, securing all window and door screens so that there are no holes. The use of mosquito bed nets can be useful, and spraying clothing with permethrin. The most important prevention is to eliminate areas where mosquitoes can breed. Mosquitoes like places where standing water is available, so the removal of flower pots, containers, vases, and other objects will help reduce the risk of dengue fever. Thank you for listening to my presentation. May the information presented help us to be more informed about dengue fever.